Hello and welcome to today's webinar, Unified Cost Containment Approach and Next Level Outcomes Using AI. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Dr. Mushir Ahmed and Dr. Rina Belinsky. Dr. Ahmed is the CEO of Cadoxo, formerly FraudScope, which he founded to help make our healthcare system more affordable and effective. Cadoxo's artificial intelligence solutions use a patented technology to identify problems and suspicious behavior earlier than traditional techniques, which helps ensure our scarce healthcare dollars go to real patient care. Dr. Belinsky is the Vice President of Customer Success at Cadoxo. She has a Doctor of Pharmacy degree from the University of Illinois College of Pharmacy in Chicago, UIC, and is an accredited healthcare fraud investigator. In previous roles, Dr. Belinsky was responsible for building several clinical cost containment programs. She also developed retail pharmacy FWA programs, which included pharmacy fraud investigations and compliance audits. At this time, I would like to turn the floor over to our speakers. Welcome.
Hello, everyone. Thank you so much for joining our webinar today. To get started, we would like to give you a quick overview on Cadoxo and the innovative solutions that we bring to the industry. Cadoxo is the provider of an AI-based suite of solutions for health plans and state agencies. Since our inception, we've quickly grown across several health plans and government agencies by providing the state-of-the-art capabilities that were non-existent in this space. We are proud to have raised the bar in the industry on what solutions can be used to address various pain points for our customers. Cadoxo helps proactively detect and reduce risks across various teams and areas such as fraud, waste, abuse, payment integrity, network integrity, contract management, prior authorization, and provider coding and billing. This complete cost containment program management is done with multiple products that sit on a common forensic AI platform that allows users across various departments to have greater visibility to bring about increased collaboration and efficiencies within their organizations. Several estimates show that healthcare fraud, waste, abuse ranges from 3 to 10% of healthcare expenditure. That translates to about $114 billion, up to $380 billion in annual losses. This surpasses numbers for all other industries, and the complexity and the magnitude of the problem in healthcare grows every year. Even though we are seeing improvements each year, we are still largely not identifying most schemes in a proactive manner, which is leading towards significant financial losses for health plans. We have some statistics on here and the sources of the statistics listed on the slides. And for example, last year we had over 300 individuals that were charged with fraud, waste, abuse last year.
Okay, thanks, Mushir. Hello, everyone. Very much appreciate you joining as well. So whether you're directly involved in cost containment or the payment integrity space or not, we know that payers and customers all have a common goal of paying claims appropriately and effectively. So there still are implications for different areas within a payer, and we are really seeing an evolution here in in this space for the requirement for a more holistic approach. In addition to the growth or changes a plan might be experiencing, certainly the pandemic has caused tremendous redirection, many of which will be permanent, such as telehealth or virtual health, even for ourselves, remote working versus being in a brick and mortar location. So despite that, or even maybe because of it, we do still have operational silos, especially in different departments within a plan. So within these departments, there are many mandates, especially on the fraud, waste, and abuse side, that apply pressure to these areas, some of which might require immediate attention. For example, if there's a egregious fraud situation that requires immediate reaction or acting quickly, to CMS mandates, client mandates. So there's increasing pressure from a payer's clients to understand how that payer is being a good steward of the healthcare dollars, in terms of asking about what are you doing for the providers? Are you auditing? How many audits are you doing, and things of that nature? And overall, how are you managing the healthcare spend? And so payers are trying to balance these compliance aspects, yet at the same time maintaining transparency with their network, with their internal stakeholders, and doing this in an efficient and accurate way. So one of the many things, at least coming out of the pandemic, we're seeing, and I'm sure many of you have seen, is a willingness to embrace technology more so than ever before, as well as new ways of operating. And in many ways, we were forced to do so. But this does allow us to really understand and dig into any insights that we have in regards to how you're saving dollars for both your plan and your customers as it relates to fraud, waste, and abuse. So back to this evolution that we're seeing, it really is a must-have now to have a holistic prepay, post-pay, and fraud methodology that services both or satisfies both the compliance and transparency aspect. So historically, we all know there's typically been a pretty heavy focus on the post-pay payment integrity process. I think that's going to remain for some period of time. Certainly, it has seen a lot of changes through the years, most recently the last few with movement to prepay, but we do know that either one really can be and has been an abrasive process on the provider network. So we are seeing that shift. If you think about it, sort of generally, 95% of providers are good, 5% are bad. So we really want to, however that is sliced in your particular plan. So there's a tendency to focus on the bad, but we really also want to have that transparency for our good providers, especially with the advent, of value-based care, outcomes-based quality. We want those providers to know that they're doing a good job, and we want to have that transparent communication. Again, more of a holistic view versus just focusing on the bad providers, number of audits, error rates, and the typical things that you might see in a payment integrity program. So prepay itself is quite effective. We have seen that shift. I think there's still much to do in that area. Little bit still of a kind of a shotgun approach. There can be a tendency to focus on high dollar claims or targeting high dollar claims, which may or may not have an error in the claim. If it doesn't, it's going to lead to provider abrasion, or there's a focus on certain providers or certain codes, but there is not a tie back to the post-pay or fraud activity. So it has a tendency to be being performed in a silo, if you will, and that's what's really prompting the use and application of technology into the prepay process, and specifically AI, which Mashir will talk about in a little bit. But the AI really allows and amplifies the detection of either simple, complex, or even unknown data issues down to the claim level. The beauty of AI, at least in my opinion, is that it's agnostic toward the data that it's pointing at and looking at. So it really can uncover and surface these unknown activities or patterns. And what we're basically doing is taking those insights from the AI on a fraud and post-pay basis and applying it to the prepay process. This is not the only solution, but it's one of the solutions you can apply into your overall or holistic cost containment program. And it's one that really is kind of, I would say, low lift but high impact for your plan, where it reduces a lot of the manual processes and gives you a little bit more in your toolkit overall. And we have a couple of case studies a little bit later in the presentation that will talk about this. So we know that challenges exist, lots of silos within a plan. Technologies have a tendency to be, in various stages of maturity, different departments. There's a prepay team, post-pay, fraud, provider education, maybe all using different data sets, probably using or potentially using different data warehouses. There may have been legacy customization of all of these data sets or warehouses along the way that at the time probably served a purpose, but over time can potentially become problematic or be harmful in the long run. So all of these interdependencies of other departments and areas, of course, leads to a lot of unnecessary red tape and inefficiencies. If you think about all the different departments, all of the activity that's taking place in silos, again, maybe remotely or virtually. So there are tactical things going on. There are audits taking place. Medical records are coming in. We've seen often where a plan has medical records in one department, maybe they're asking for those same ones in another department, and the plan may not even know that those medical records are in-house. Appeals are taking place, communications with providers are going on, cases are being created from the fraud side, edits are being put in, policy changes are happening. So there can be a lot of overlap and miscommunication, both internally and with providers. And all of these departments have different types of reporting. So when they're rolling that up to the executive level at the plan, that requires consolidating all of these disparate data sets and reports into something that's consistent and accurate, that can present challenges. And we know that things can get lost in the shuffle, if you will. Things can be reported inaccurately or underreported or misreported. So as far as missed opportunities, it's not necessarily related all the time to missed recoveries or related to recoveries, but it can be also a missed opportunity to improve a process, change a policy, put in an edit. Some of these edits can be very small, but over time can translate into millions of dollars. We know that the payment integrity function within a payer is a very complex and highly nuanced function. And so managing all of these balls in the air and juggling all of these details is very critical, and the details really do make the difference. So I think now we have a poll question, so I'll turn it over to Monica.
Thank you. In order to participate in the poll, please make sure you're not in full screen mode by clicking on the escape key, and that way you will see the poll pop up on the right-hand side of your screen, on the right side of the slide deck, and that poll reads, in your role, which of the following silos is most challenging? And you have 4 answers to choose from. So we have A, is it department and operational? Is it B, data? Is it C, technology? Or is it D, reporting? So once again, we do appreciate your feedback. And that question reads again, in your role, which of the following silos is most challenging? I want to let that poll run for just a few more seconds. Your feedback is appreciated. Is it department and operational? Is it data? Is it technology? Or is it reporting? And thank you for your participation. And I will turn it back to our speakers momentarily, and they can certainly reflect on those answers. Okay, and we're going to go ahead and finish out that poll. And I will turn it back to our speakers who will speak to the results. Thank you again.
Okay, interesting. So I always love to see the results of these. So this is great. Fantastic. Thank you all so much for participating. So half of you, or over half, have reported challenges with data, and that is super consistent with what we hear and what we see. And hopefully we'll talk through some of that and address some of that throughout the presentation. But again, very, very common. I think that data in our industry is always a challenge, will continue to be a challenge. And so there's certainly a need for solutions in that regard. Go one more.
Perfect. To help address the challenges we've just discussed, we're going to discuss a holistic, unified approach to the problem. And this holistic, unified approach includes employing the state-of-the-art predictive analytics that help identify problems and opportunities a lot sooner than they become major financial concerns across various departments. Today, a lot of the analysis that's done identifies issues that have been festering on for so long and have already caused a huge financial impact to the stakeholders. So the goal of the unified approach is first to find things a lot sooner before those financial impacts become excessive. The second part is enabling holistic reporting across the organization to improve sharing and allow decisions to be made for the best outcome of the organization as a whole. And as we saw in these the polling answers, reporting about 27% of you did indicate that they are reporting silos. So how do we break down those silos and have reporting across the entire organization as opposed to individual teams and focusing on the goals of that team? The next thing is to accurately flag claims very early in the process that will enable us to make improvements and avoid chasing the dollars after they've been lost. And I think we all are very aware that we spend a lot of time trying to chase dollars as opposed to proactively um, take action much early on. And that's the shift that we want to help accomplish in this industry. The other aspect is to include providers in the process by improving the speed of notifications as well as giving them the opportunity to address concerns to prevent abrasion. A lot of times they are notified very late in the process, which adds to the abrasive tendencies. And helping educate providers early on and giving them an opportunity to move towards better billing practices is something we should hope to accomplish and move together as stakeholders. And of course, finally, adding automation where possible and embracing the appropriate technology so health plans can focus on more critical tasks that require their expertise is a goal of the unified approach holistically. All of this should be done within one collaborative platform that helps all stakeholders make the best decisions to address any emerging problems and prove that we are good stewards of our healthcare dollars. The goal of AI is to help us gather insights from large volumes of data. However, all AI has not been created equal. AI is a very complex field, and if you use the wrong kind of AI with the problem you're trying to solve, you may never achieve the most optimal results. What's unique about Cadoxo is that our entire platform that helps achieve the holistic, unified platform approach that I just described was built on an AI-based architecture from the ground up. We employ a large team of data scientists who have PhDs from leading academic research institutes that actively conduct research within our organization and help us stay ahead of any technology that's out there in the industry. Our AI operates on all claim types, such as professional, facility, pharmacy, dental, and behavioral health, and also at various levels, from individual provider claims through their groups, networks, plans, etc. So we can operate at any level and any claim type. And our AI is designed to maximize outcome by uncovering not only the existing problems that we are aware of, but also identifying emerging issues that are constantly evolving and hitting the industry at all times. So, fraud, waste, abuse, as we all know, is not a static space. It's a space that's constantly evolving, and with every day there are new things that do come out. And the goal for us as an industry is how do we stay ahead of the trends and keep us protected from those that want to steal our limited healthcare resources. The way our self-learning AI works is it analyzes the claims data, identifies behavior-based patterns, and detects outliers as they emerge. And the speed of detection is one thing that makes us extremely unique in the industry by allowing our customers to find things a lot sooner. Our self-learning AI has the ability to explain these findings to the user while gathering the evidence and automating the process of evaluating the results that are being generated. We can identify entities that are intentionally or unintentionally wasting money a lot sooner than other technologies that are available. And the goal of our technology is to build connections and provide actionable insights and get smarter over time. And that's what keeps us very effective in this space and allows us to help our customers achieve the results that they do see. In a recent KPMG study focused on the adoption of AI across many industries, it was shown that the healthcare industry is adopting AI technologies at a good rate. This is exciting to see that healthcare is taking hold of new ways and new technologies, and even more exciting that they are eager to get the technology up and running, as many respondents indicated that their AI investments would be up and running faster. But the main takeaway here is what we see in regards to the impact to inefficiencies that are being addressed, with nearly 90% of respondents indicating AI is making an impact and creating efficiencies where applied. There are additional opportunities that exist to augment business teams and reduce highly manual, labor-intensive tasks so teams can focus on their areas of expertise. And with that, we'll move to our next poll question.
Thank you. Once again, a poll is appearing on the right side of your screen next to your slide deck. Make sure you're not in full screen mode in order to participate. So go ahead and click that escape button in order to see the poll popping up on the right side of your screen. And this poll reads, at what level has your organization invested in an AI strategy? And there are four choices. A, no investment with no current plans to invest. B, no investment with intent to invest in the near term. C, moderate investment, or D, significant investment? We appreciate your feedback. So at what level has your organization invested in an AI strategy? And we'll pause for just a few moments while we assemble all of your answers. Again, thank you for your participation. Okay, I'm going to go ahead and turn things over momentarily back to our speakers who can address the results.
Perfect. Thank you, Monica. So the results are in, and as expected, we do see that about 43% of people responding say that there has been a significant investment, which mirrors the KPMG study, and we're happy to see the industry move in that direction. About 7% have said that there are no plans, and hopefully those organizations are in the future planning to, are hopefully decide to move in the future to adopting more AI technologies. But it is good to see that significant a majority of respondents have said either significant investment or moderate investment has taken place. And I think the opportunities of having greater impact with AI are only growing. And this is just the beginning of the industry to help that is realizing the potential of the impact of this technology.
Okay, so many of you had responded about the challenge you have with reporting, and it certainly is that. We've all experienced it in one way or another. I think reporting, depending on how it's viewed, can mean different things to different people, different departments. Are they internal facing? Are they external facing? And there are various levels of reporting. And so it is critical that from the beginning that an entity is learning and understanding what their reporting requirements are versus thinking about that kind of later in the process. And we see that time and time again where it kind of becomes an afterthought versus building it out from the beginning, or in our case, from a core AI platform. And so depending on your audience, there can be a need for high level reporting, lower level down to the claim level, all of which require a lot of different levers and a lot of thought to be put in, again, at the beginning of any given process that's put in place. And the key really is understanding the value that your reporting brings. What are the drivers for those reports? Are they, how dynamic are they? Are they easily updated from month to month or week to week or even on a daily basis? Or is there a lot of ad hoc things taking place that, again, over time will cause issues? But just again, the key is, what is the value? What are the insights? And how are those displayed? I mean, displaying from a report perspective can really make a big difference in terms of someone's understanding of the insights that are in that reporting. So to kind of tie this together, we've talked about the unified approach. And if you think about the departments we've discussed, so fraud, waste, and abuse department, which typically can, not always, but can consist of an SIU, a prepay team, a post-pay team. Now they have the opportunity to be in the same technology platform. Perhaps they're going into different entry points, but with the visibility now to see what the others are doing, we consistently come across clients where the SIU may not know what payment integrity is doing, who may not know what the prepay team is doing, who might not know what the provider education team is doing. So again, back to those silos and the inefficiencies, Whereas with one platform, you have the ability to see everything at the same time and with consistency. So this gives you great efficiency, but then also now you extend that to traditionally non-payment integrity departments, such as the clinical areas, networking, contracting, underwriting. uh, all of those different areas now also get to see different slices of these same insights. And most importantly, and the key here, I think, is this is all sourced from the exact same data set. So with many of you mentioning your challenges with data, you now have one place where that data is housed, and then that gives you that holistic view where everyone within, not everyone, but many departments within the plan have the ability to kind of see the same thing from the same source. And then also the reporting then, which you also have all expressed as a challenge, you now have reporting that is very consistent and from the exact same data source. So you're now showing value to your customers. The what and the how of you were able to get to that information really helps you show that stewardship of the healthcare dollars, which is a very critical piece.
So here's an example view, kind of indicating what Rena just mentioned about housing all your data in the same place. And sometimes we've also seen organizations that have multiple claim systems, which which are a lot of users within those plans have not had an opportunity to see all their data across various systems in one place. But having the ability to merge data from multiple sources, maybe across different claim systems, together in one place and see various claim types to give you the ability to, for example, in this screen that you're seeing right now, to see patient history across claim types is a very powerful thing that you can have access to. So when users have access to this data on a single screen, they can have a more comprehensive view of the healthcare activities of a patient, and the data does not remain segmented anymore. Our current customers are able to identify complex issues and address inefficiencies today using these views, which are not typically available to them in an easy manner. So, extracting information at this level would be highly involved across systems, but we try to automate that process and give you access to this information. And this is just an example of one of the places where we are able to help bring a unified approach in this space. In addition to that, we also need to place a strong emphasis on provider education, which can help bring down pre-claim cost and provide greater transparency to providers. One of the ways this can be done is by using an online provider self-monitoring portal that improves provider engagement and drives positive changes in billing practices. This helps complement existing staff with enhanced claims monitoring that is more comprehensive and complete, and that improves provider engagement and drives positive changes in their billing practices. Um, it can help providers compare and monitor certain claim patterns that are of concern to the health plan, helps reduce coding errors by educating providers and their billing staff to influence costs prior to the claim submission. And the goal of this, of course, is to avoid provider abrasion while increasing cost savings by encouraging provider behavior change. We can maximize coding efficiency and accuracy and educate providers on the correct billing practices and helps reduce errors in low dollar, high volume, as well as expensive codes used by providers. And these capabilities can be provided through the provider scope application on our platform.
Okay, so as I mentioned, we had a couple of case studies to discuss with you today. Our first one is from one of our clients, which is Highmark. They recently did have a press release related to their overall fraud, waste, and abuse program. But this is just one of the examples of a more immediate identification that they had using the AI. I would say it was within days of applying the AI to their claims, and it identified this outlier behavior for psychotherapy providers. And in this case, as Mushir mentioned a little bit earlier, AI is, and ours was designed to identify that evolving things that might be taking place, or schemes, or potential uh, outlier behavior that a provider might be doing that you may not be aware of. And in this case, that was identified really under the radar for them, and it had several implications. So not only was there an identification of this situation with the codes, but there were contractual implications that surfaced. And after some investigation, they also saw that the records really didn't support the use of the codes that they were billing for. And so the key takeaway here is not just the fact that there is a significant recovery, again, kind of back to that stewardship, but learning on the contract side for the plan, not only for this provider, but for other providers. And then also the other key thing is taking this learning and then putting that provider on a prepay review. But without that AI identifying this scenario, that would have never happened. We would have never been able to surface this, again, kind of just right underneath the radar, which is something, in the fraud space we're all chasing. And so it really allowed them to be much more proactive rather than reactive in this case, and putting them on prepay. So a little bit back also to the missed opportunities that we spoke about earlier, but this really helped to also prevent further exposure for the plan. And then this is just another example I wanted to share with the group, the participants, which is tying back to those tactical procedures I was discussing earlier that are part of a fraud, waste, and abuse or payment integrity program. This is an example of viewing AI through or in place of what a payment integrity process would be, which would be very done manually, maybe using Excel spreadsheets or Access or Tableau or something like that. Whereas in this case, the AI is picking up these coding combinations that more than likely may not have been surfaced, but they were using the AI, again, faster and easier, so with efficiency rather than a manual process. And once these were identified and researched, it was also observed that there had been a coding change, but the provider was still using the obsolete coding combinations. So not only are you getting kind of that quick identification, maybe recovery, but you have other implications that affect your plan. So in this case, there was significant recovery and an opportunity for that, but there were also the ability to look at other things. So with that, I'm going to turn it over to the moderator for any questions.
Thank you. At this time, we are going to address some questions that have come in during the presentation. As a reminder, please go ahead and type your question into the Q&A box located on the right side of your screen and click Enter. And we do have some questions that have come in, and I will go ahead and jump right in. Dr. Ahmed, this one, it looks like it's for you. What What are health plans finding they benefit most from the AI? What are health plans finding they benefit most from the AI?
That's a great question. And we mentioned during our talk that our entire platform from the ground up and all our processes have been developed keeping AI in mind. So, right from the get go, from the beginning of our relationship with any customers, what we find is our go lives are significantly faster. We have the fastest go lives in the industry where our AI capabilities and our automation capabilities allow us to go live with a customer in about 8 weeks from the day we receive data from a health plan. So in 8 weeks, if anyone decides to adopt the AI-based approach and our the Cadoxo forensic AI platform, from the day we receive the data, we are able to go live 8 weeks, which is a pretty aggressive timeline for the capabilities that we are providing. When we typically go live, we find that in the first couple of weeks of usage, we are able to identify very interesting cases of fraud, waste, abuse that may not have been identified in the past. There are lots of things that are surfaced from the AI that a lot of times health plans are not aware of. So we do have the ability to find emerging things, and after, of course, we go live and we are live with our customers, we're able to find emerging schemes very quickly, very early on, before they start bleeding significant dollar amounts from health plans. So there are a wide range of benefits from faster go lives to finding things that were not identified before, in addition to finding things that we are identifying previously, as well as automating some tasks to help drive strong outcomes without having strong and deep knowledge in AI modeling and other AI techniques. So I would say there's a whole range of benefits that can be obtained. But of course, the primary benefit, the most significant one, would be our ability to find things faster, which ultimately will have the most financial impact at a health plan.
Thank you for that answer. Our next question looks like it's for Dr. Belinsky. Let's see. What has been the feedback around provider self-monitoring? So once again, what has been the feedback around provider self-monitoring?
Yeah, so I would say that, thank you for that question. I would say that the feedback we have seen from both our customers on the provider, what we call provider scope, and the self-monitoring for providers, and then there's feedback from providers. So I'll address the customer first. One of the things, or several feedbacks, are that we are getting is a plan likes the provider scope and the way it's been designed, because it's very low impact, low abrasion. Again, the AI is picking up the different coding combinations or whatever the provider might be doing, whereas traditionally that area has targeted known combinations, for example, E&Ms or high E&Ms and upcoding and things of that nature, whereas we really let the AI tell us what providers have outlier behavior and why they have that behavior, and then we're able to educate and communicate with that provider. And so from a customer perspective or plan perspective, it's sort of taking the lift off of the plan, letting Cadoxo manage that process, communicate with the provider if they have questions about what was identified or the communication that was sent to them. Not only can the provider go into a portal and see how they compare against their peers, which is very powerful, again, getting back to that transparency topic, which is customers have said or plans have told us, we love the fact that you're we're able to communicate proactively with providers versus down the road getting into a situation with something is suspicious or there's a significant recovery situation. And we've had specific feedback where, customers have told us this is really nice because the provider gets that feedback proactively and they really appreciate that feedback. So from that perspective, that addresses the customer. And then on the provider side, we do see kind of a spectrum of feedback. Some are very appreciative. For some, it's very eye-opening. If, for example, they use a billing company, they're actually not fully aware of how their claims come across and what their billing company might be doing. So and it really gets to that education piece. And so they're very appreciative that they got the information proactively before anything else would have to take place. And then if they're in a value-based care, it's good to be able. We provide our plan. Here are the providers that had some different scenarios. All these other providers are looking great, and so the plan is able to communicate to those providers as well. And so I think generally, many of you probably know on the provider side, you do see that spectrum. Some kind of don't want to be bothered with it. Some, however, do appreciate it. And the ones that see it and appreciate it tend to change their behavior. And that's where it gets to be very impactful, again, to that low impact, but high reward and low abrasion, where when things are identified, they can be managed very quickly. And all of that is done on really a cost avoidance basis. So I would say a bit of a spectrum on the feedback, but generally really good feedback.
Thank you. Next question has come in. How quickly are clients typically finding outlier behavior? So I think this one is also for Dr. Belinsky. How quickly are clients typically finding outlier behavior?
Yeah, as the Highmark example is a good one where it was extremely quick. I would say generally, depending on the level of sophistication of a client or plan that comes to us, what type of models they've been using. Did they have a manual process? Did they have somewhat of a more sophisticated process? But I would say generally it's an eye opener. We take the claims, we run it through the AI, the way that it's displayed. Many of our clients, not only do they validate and confirm that things that were identified are known things to them, but there's an awful lot there too that they weren't aware of. And so, I mean, that is what the platform and what it does. And so I would say it's a very quick to ROI, but also just insights into the provider behavior and what's taking place. Some are a little bit more subtle. For example, if there's a prescriber with opioids, okay, maybe you'd focus on that. But with our platform, you can quickly go into that provider or prescriber's medical claims and see, well, over here they've got a lot of upcoding or high E&Ms or something else is going on. So there can be kind of a combination of both quick and then interesting, I would say, schemes that sort of start to unravel and being able to see common patients, common providers, seeing that information on a map. All of that, again, in a very holistic platform, allows our clients to get to that information pretty quickly. And then once they've gotten into a cadence with us and we're getting refresh data, they're able to very proactively see what's happening with that next data refresh. If it's on a weekly basis or a monthly basis, they know what's happening pretty quickly versus kind of 6 months or 12 months down the road in a post-pay world, that they know what's going on with their claims and with their providers.
Okay, thank you. So, next question has come in. How are you working through the data challenges with your customers? Either one of you. Thank you.
So I'll take that. Maybe Mashir, you might want to add to that. I would say that we take a very concerted approach. So understanding from a data perspective what they are dealing with, what claims platform are they using, do they have multiple claims platforms, the data that's coming to us, where is it coming from, what kind of challenges do they have. So yes, everyone kind of has a typical or standard data specification document, but as long as I've been in this business, which is a long time, everyone's data is just a little bit different. And so that is what presents a challenge. But our data scientists and engineers and our teams really look closely at that data to say, okay, here's what we think might be a challenge in the platform. Here's what we have. And certain things, there are limitations, right? So if you may or may not have a certain field, we are identifying that early to help our client understand the impacts of not having it versus if we do have it, and what's the effort involved to get that. So I would say that we take a lot of time in the data process function to learn and understand our customers' data. We know how it's going to be displayed in the platform and how it works in the platform. So we know exactly what to look for and ask for. And then we really help our clients, walk through that process. And so I'd say that's how we're addressing the challenges. Mushir, if you want to add to that.
Yes, so a lot of health plans do have data issues, and as Rena said, their data issues are across various issues. Like sometimes the data is not complete. There's certain fields that are not being captured. Let's say we do have plans that we've come across that just don't capture the billing provider information consistently or referral information consistently. Other plans have integrity issues. For example, their specialty information is not very accurate, and sometimes highly unusual when you have a pharmacy listed as a chiropractor or things like that. So I think every health plan does struggle with different aspects of their data, either the integrity or the completeness. And we have a very strong ETL process and ETL team that's highly accustomed with working with data issues and ensuring that those issues, the impact of those issues are minimized in the services that we provide. So I definitely want to let everyone be aware that even if your data is not perfect, we do have the capability to address them within our organization to make sure that the impact of bad data is minimized to the maximum extent possible. So that should never be a reason why someone is hesitant to move to a advanced platform or an AI-based technology, because they do know, and we have come across that in the past, where health plans are eager to adopt new technologies, but they are aware of the data challenges, and that brings about a lot of hesitancy in, should I make this transition to this advanced platform when I know my data is not great. So that's should never be a barrier. Definitely, we would be open to having a conversation and helping you address any data issues that you may have, and we've become pretty accustomed to dealing with that with all our clients.
Thank you. I think we have one last question that has come in. It reads, is manual validation of claims still a norm post-AI identification of potential claims?
So yeah, I'll take a stab at that. I would say that generally manual review isn't necessary. So with our platform, claims can be identified usually at the provider level. A case can get created. Often there could be medical records reviewed, but in terms of validating a claim, I would say there's not a lot of that going on, but we tend to, create the case. Our clients will make some determinations based on what they're seeing in terms of the behavior for that particular provider or scheme or whatever the scenario might be. But in terms of manually reviewing a claim, I would say, there might be some, validation in the claim system for anything that may have changed. But other than that, the claims are displaying, accurately, and there's very little manual intervention other than in the event there was, clinical review necessary or medical records needed. And in that case, our clients can, request a medical record. That's our payment scope product where medical records can be requested and reviewed by either them or us to make any type of validation or determination.
Thank you. Thank you for that. And thank you both for that great presentation and for sharing your thoughts. Thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again, and enjoy the rest of your day.